Hey guys, welcome to episode 129 of the OCDstories.com podcast. And in this episode I got on Dr. Jenny Yip. Jenny is a clinical psychologist who specializes in OCD and anxiety. She runs the Renewed Freedom Center based in Los Angeles, and she's also a clinical advisor to the No OCD app. So I've been aware of Jenny for a while, so I was happy to get her on. And in this we talk about her OCD story. So although she's obviously a professional in mental health, she has her own OCD story. And we discuss that. We talk about the maternal side of things, when it got worse when she had her twins. And then we go into sort of lifestyle changes, what's helped her therapy process. Then we get onto the more, me asking her questions as a clinician. So, what she's noticed in her clients that recover quicker, what's different about them. And then we go into, over the last 10 years of treating OCD, has her view changed of how she treats it? And if so, how? In her experience, what have been some of the sticking points to recovery and how she overcame them with her clients? Then we talk a bit more about the impact of constantly being on our phones and how that may negatively impact our OCD recovery. Cover a million and one things in this. I learned a lot, which is always the mark of a good interview, for me at least. I think she's a great person. I think you'll enjoy this one. So without further ado, here is Jenny. On the podcast today, I have Dr. Jenny Yip. Jenny is a clinical psychologist who specializes in OCD and anxiety. Jenny runs the Renewed Freedom Center based in Los Angeles. She is also a clinical advisor to the No OCD app and author of the book Productive Successful You. Welcome to the podcast, Jenny.
Thank you for having me.
It's good to have you on. You come highly recommended, so I had to get you on. So it'd be good to get, I know you have or had OCD. So before we get into your picking your brains as a clinician, it'd be good to hear your OCD story.
Sure, absolutely. I've had my own personal battle with OCD since the age of 4. I remember my very first fear was about death. I asked my sister what it was like to be dead, and one of the first things that she told me was that you stop breathing, that your body doesn't take in air anymore. So what I did as a 4-year-old was tested that out. I stopped breathing. I held my breath, and that feeling was the worst feeling that I ever experienced, during that time in my life. So from that point on, I was just so focused about making sure that I could breathe. And then, of course, you know how it goes. The more you focus on something, the more daunting that thing becomes. So I would constantly be breathing in the way where my chest would be expanding to a point that I could see the air going in and out of my body, to the point where I was actually hyperventilating at that point. So that stuck with me for a few years, and then when I got a little older, I started having fears of harm befalling my family members, especially my younger sister, who was just a tiny baby at the time. And I remember just having these horrific images and wondering, why I was having such horrible images. And this is probably about the age of 5 to 6. And because I was so terrified by these images I was having, I would want to preserve any memory that I had of my sister. So whenever she would do something that I felt I needed to capture, I wanted to make sure I remembered, I would ask her to repeat that action or repeat that behavior, repeat that smile or whatever it was. And I would ask her to do it again and again and again so that I could try to capture the moment. And it's almost like I was hoarding images, hoarding mental photographs in my mind, just in case that these horrific images came true. And I remember being terrified at night because obviously OCD is the worst when your brain wanders off to Never Never Land, and nighttime when you're trying to sleep is one of those times when you're most at risk. So I remember just being in tears all the time and telling my parents what was happening, and obviously they didn't understand. They was wondering what was wrong with their daughter having these horrific images of their baby, you know.
Yeah.
You know, they shared the information with the pediatrician. Nobody knew what to do with me. And over time, my OCD kind of just waxed and waned and evolved to many of the different subtypes. And it wasn't until I was in college that one of my professors noticed my writing and erasing and writing and erasing. You know, back then we didn't have laptops at school. You know, we used paper and pen. And she called me after class and asked me about it. And that was the very first time I had heard of the term OCD. And it was such a relief hearing that it wasn't just something, you know, with my quirkiness or something was wrong with my brain, that there are actually other people who have similar behaviors that I was engaged in. So that's you know, that was what I experienced. And then in my graduate studies, I interned at the Behavior Therapy Center with Dr. Charles Mansueto, and he basically gave me the training of most everything that I understand today about OCD. So I had to do my own exposures as I was doing exposures with my patients, and from that, you know, I was able to overcome a lot of the symptoms, and I never really realized that I would have to deal with my own personal OCD symptoms again. And I lived, you know, the next 15, 20 years being symptom-free. I mean, I would have, you know, my bouts of intrusive thoughts here and there, like most people who's recovered, except, you know, I was able to ignore them easily, unlike the past. However, when I gave birth to my twins a year and a half ago, I was shocked that OCD returned with a vengeance. And even I at myself at that time did not realize it was OCD because, you know, OCD, it's different for everyone, right? So no two persons who with contamination fears or washing compulsions is going to have the exact same thing for the exact same reason. So for me, even though at that time, postpartum, my fear was harm befalling my twins, it came about in a very obscure way. You know, it wasn't your typical, you know, I might drown my baby, or I might poison my baby, or I might suffocate my baby. It was, I might do emotional damage to my baby if I loved one more than the other, if I cared about one more than the other, if I paid more attention to one than the other, if I did something that seemed like it was in favor of one compared to the other. So that's not your typical postpartum OCD fear. So I didn't really recognize it as OCD until, you know, many weeks later when I caught myself checking my memory bank. And every night, even as sleep deprived as a new mother with twins I would still lay in bed every night checking my memory bank for how much I thought of each twin, comparing the content of the thoughts, comparing my emotional reactions to the thoughts. And that was when I realized, this is OCD.
Yeah, it's tricky, right? It almost probably knew it couldn't catch you out with maybe some of the other thoughts because you probably practice them practice them all the time with the clients you work with. So it kind of gives you this one that you've never even heard of, even as a clinician.
Yes. It's like, okay, well, the stuff about, I also had the common, the washing, the sanitizing baby stuff, and, fearing that they would die in their sleep from SIDS. However, those weren't the most daunting. Those I was quickly able to nip. However, the thing about fearing I would do emotional damage if I cared about one more than the other, if I favored one more than the other, that was the one that really caught me off guard.
So, thank you for sharing all of that. So where are you at now with it, if you don't mind me asking?
Well, I had to come to terms that sometimes I'm just going to love more than the other. The funny thing is they're going through their terrible twos right now. So, I constantly joke about this, that if babies went through their terrible twos, it's hard to have OCD when you have, a toddler who's saying no to you all the time, or throwing food and, coming and pinching you, which is what my toddlers are doing these days.
Yeah, very true. Okay, so you, as you said, you did ERP and CBT. Is there anything else that you do that helps maintain a healthy mental well-being, whether that's kind of exercise, nutrition, meditation, etc.?
I think all of the above. In order to have a healthy mind, you have to have a healthy body. So if you are eating poorly, the lack of nutrition is going to affect your brain, which is going to affect your mood. If you're not getting enough exercise, the lack of the good hormones are going to affect your brain, which is going to affect your mood, So healthy eating, healthy exercise, daily meditations, whether you're just doing a mindful walk or you're doing yoga, whatnot, time to yourself to be is really important. Being able to focus in this moment, because, anxiety and fears take over your mind either in the future or in the past, right? You're either ruminating about what might happen in the future, or you're worried about something that already might have happened in the past. However, when we are able to be in this moment, anxiety can't exist in this moment. And if it does, you simply react to it. You simply physically respond to it, right? So we live in Los Angeles, and if there's an earthquake, yes, my fight-or-flight response will be triggered, and I will react to it. I would not be frozen, unable to move, and stuck with the thoughts in my mind, because that's not what the purpose of your body's fight-or-flight response is. Is there the freeze response? Yes, there is. However, the way that I perceive your body's fight-or-flight response, it's there to equip you to survive. If you just froze, you would not be a very well-made machine equipped for survival. So in this moment is where anxiety and OCD fears cannot exist.
Yeah, absolutely. Yeah, I love that. Okay, so as a clinician now, what are some of the key characteristics you notice in your most successful patients when they approach treatment? So successful in this context being that respond the best to the treatment. As in, kind of, what's their mindset?
I think there are two factors. One, which is the rapport that you have with your patient. The second is the patient's belief in the process. Because in cognitive behavior therapy, and more specifically exposure and response prevention therapy, what we're asking patients to do is confront their fears. That's what we're really asking you to do, right? We're asking you to expose to the triggers of fears that you have been avoiding all this time, which is why it's become a problem. And what we're asking patients to do is to confront your fears so that you can demonstrate to yourself and learn that this fear does not have the power that it holds, that this fear actually is not that threatening, that this fear doesn't have the substance, the credence that we're mentally giving to it. So that would be a daunting task for anyone, not just a patient with anxiety and OCD. So if I am not going to believe in the process, why in the world would I go and expose myself to a fear, right? That's kind of like, well, if I'm afraid of lions, I'm going to avoid a lion, right? Except what we're telling you to do in exposure and response prevention therapy is to go and throw yourself into the lion's cage. Now, many of us would not do that. What a patient with anxiety and OCD doesn't understand is that the fear is irrational. And therefore, you have to engage with the fear in order to learn that it is irrational. The problem is that we don't allow ourselves the opportunities to engage with the fear. And therefore, we never get the feedback that this fear is irrational. So believing in the process, believing in your own ability, believing in your therapist, those are some of the most, that's really the key ingredient to success in treatment. And therefore, the rapport that you have with your therapist is going to determine how much you believe in that process. Because if you don't have the rapport, you're not going to believe what your therapist is asking you to do.
Absolutely. Yeah, really good point. So has your view of treating people with OCD changed in the last 10 years? And if so, how?
I don't think so. I started working with OCD patients in 2000 at the Behavior Therapy Center in Washington, D.C. And, back then I was working with a family, and I was really, really just, demoralized, because at that time I was working with the child, and everything that I did with the child was being undone once the child got home. And I remember going up to Charlie and saying, hey, I don't know what to do. Everything, all the exposures I'm doing is working well when she's here in the office, and then once she gets home, it all goes down the drain. So Charlie, being Charlie, asked me to go do my research, go look it up, do the literature search. And as I was researching, I realized that there was not much information about working with children and family members. In fact, I believe at that time, Dr. Barbara Van Noppen was one of the only people or one of the first people to do a pilot study, and her pilot study was about working with families in a group setting, or working with parents in a group setting. So that kind of guided me to what I wanted to do, because for me, I was first and foremost a child therapist, a pediatric therapist, and then second, an OCD therapist. And working with children had always been a priority for me. And if I wanted to work with children suffering from OCD, I knew I had to come up with a a more realistic way of working with children where the exposures that you did with them would be maintained even at the home. So at that time, I was coming up with a family protocol, and I had the assistance of Dr. Van Noppen, as well as Chloe Madonis, who's one of the co-founders of Strategic Family Therapy. And strategic family therapy is very, very useful for patients who are resistant. And, that fits right along with patients going through ERP, right? It's going to trigger a lot of resistance. So my dissertation was exactly that, coming up with a family treatment protocol that would be useful for children. And I've been applying that since, the early 2000s, and I don't think my perspective has changed into how that is effective. And, that's exactly what families need. It's important for family members to realize that, yes, as parents, our instinct is to care and nurture our children, except there's a difference between caring, nurturing, supporting your child versus caring, nurturing, and supporting OCD. And part of treatment with family members is really to draw that boundary of understanding where that line is and how you have to establish these boundaries so that you can support your child and not that OCD monster that's hanging on to your child.
Yeah, really good point. I think that's a point that needs to be labored and emphasized, is that you can work with a young person or a child, but if the kind of parents aren't on board or don't fully get the impact, to say, reassurance seeking could have, you can quickly unravel the good work that's done in session. Okay, no, that's fascinating to hear.
And that happens all the time, not just with the little kiddos. It happens with adult children who are living in their parents' home, or even adult children who are living outside of their parents' home, yet constantly seek reassurance from parents. I've had many young adults who are off, on their own, they're in school, yet they're constantly contacting their parents seeking reassurance. And if a parent is unfamiliar with OCD or OCD reassurance-seeking behaviors, that parent might just respond, yeah, of course, that's safe to touch. Yes, you're doing fine, right? Because as parents, that's what we do. We, reassure our kids that they are doing fine, except that for OCD cases, you're not reassuring your child. You're reassuring OCD.
Good point. Yeah, absolutely spot on. And I guess that advice goes to everything, right? Because it could be sibling relationships, it could be romantic relationships, that's still happening.
Yes.
Okay. So in your experience treating clients or patients, what do you see as the most common sticking point that holds people back in recovery?
Well, I think it depends.
Yeah.
If it is, I've had many patients who come to the Renewed Freedom Center for our intensive outpatient program, and families are always a part of treatment here. Because again, the goal is for family members to learn that fine boundary of where does the support stop and goes into enabling the child. I would say that for family members, it's them. It's not knowing where that boundary is, or sometimes it's, I can't tolerate seeing my child in discomfort.
Yeah.
And therefore, I feel the urge to give in so that I can either maintain peace for my family, or that I can nurture my child. Because you have to understand, the vicious cycle of OCD affects the individual and affects family members just the same, right?
Yeah.
Because the fear for the child is whatever that OCD trigger is. And then that person engages in some sort of safety behavior or avoidance behavior in order to gain relief, even though it's temporary. For family members, it's no different, right? The fear is observing my child in distress, or being on the receiving end of my child's anger outbursts, emotional meltdown. And therefore, that causes me as a parent a lot of distress. And what I do is I either give in to my child's request to maintain peace for all family members, or I give in to my child's request to do this or that, or allow my child to avoid in order to stop the guilt that I'm having because I can't tolerate seeing my child in discomfort. So in essence, what family members are doing is exactly the same as what we're asking the child to not do, right?
Yeah.
And family members, sometimes it's just too hard for parents to recognize that when they are facilitating OCD behaviors, they're actually doing more damage than good. Because what they're doing is they're taking the child's opportunity away to learn that this threat is not harmful, right? And children look to parents as role models. So if the child sees the parent giving in to their OCD requests, what motivation will that give the child to resist their own compulsions, to tolerate their own distress? Right? If I see my parent not able to tolerate discomfort that I bring on to the family, what motivation does that give me to tolerate my own distress?
Yeah, absolutely.
So a lot of times, it's the challenge of getting family members to understand that, your primary goal, this is what I tell parents all the time. One day you will die. Hopefully it's not before your child dies, right?
Yeah.
However, let's say that you died today. Will your child be prepared to face the world, to thrive in this world? And if you are constantly there, fulfilling every single request from your child, whether it's OCD or not, how is that preparing your child for the real world? And in essence, you're suffocating their own confidence, their own ability to experience their own limits, their own possibilities, to gain the knowledge that they can do this and that. You're taking those opportunities away from the child, and that keeps them in that vicious cycle of OCD, of suffering from OCD, rather than being able to thrive in this world.
Yeah, no, I love that. I think that's a great way of looking at it. And I think that's a very honest and frank conversation to have with parents, or if someone's older, with maybe a spouse or sibling. Yeah, I think that's sometimes, those frank conversations are important. But yeah, no,
I think a lot.
Yeah. Sorry, go on.
I was going to say, I think a lot of times, patients and family members, they need that reality check.
Yeah.
They need to realize that engaging in these behaviors doesn't solve the problem. And what is insanity? Insanity is doing the same things again and again and again, hoping for a different result, right?
Yeah.
So rather than doing the same things again and again and again that hasn't worked, it's why not try something different? That might work. Experiment with different responses, different behaviors to your child, and maybe something different will work better.
Yeah, absolutely. I agree. Yeah, you've got to get playful and curious in treatment and try different things. Okay, so on your website, I think it was your personal website, which I'll link in the show notes, you did a news story for a local news station talking about the importance of unplugging from your phone or from technology because we're all so distracted.
Oh, yeah.
Yeah. So in relation to OCD, does people's attachment to their phone, laptop or social media interfere with treatment or recovery in any way?
I'm sorry, can you ask that again?
Yeah, sorry. So does people's attachment to their phone interfere with their treatment or recovery? And I guess the reason I ask that is because constantly checking your phone in a way is a compulsion. Even if you're not doing it for OCD reasons, it's still, I'm guessing, nurturing that part of your brain, which is reacting all the time.
Right. Well, the reality is that more and more of today's generation is addicted to their cell phones. Mm-hmm. And they're using their phone either to distract themselves or as a form of validation. So they gain some sort of gratification from whatever validation they get from social media or whatnot. There have been many patients that we've treated here who would use their cell phones to distract themselves from OCD thoughts or OCD behaviors. And, the purpose of treatment is to expose yourself to the daunting thoughts and resisting the behaviors. Yeah. Not by distracting yourself and thinking about La La Land. No, by actually thinking about that yellow duck that you've been trying not to think about, right?
Yeah.
So don't think of the yellow duck. What are you going to do? You're going to think about it even more. Don't think about your contaminated hands. What are you going to do? You're going to think about it even more, right? So in order to counteract that, what we're asking people to do is actually think about your contaminated hands. Think about all the possible consequences that come from your hands being contaminated. I want you to purposely think of that yellow duck. However, if you are going to plunge your face into your phone, that serves as an avoidance. And avoidance behavior is a form of compulsion, which doesn't facilitate the effectiveness of exposure therapy. Mm. So it's important to unplug digitally, not just for OCD reasons or treatment reasons, also because when we are too many of us today are distracted by our phones. I mean, how many times have you seen a person cross the street with their head down in their phones and not observant of the potential car that's turning right into you
every day,
right?
Yeah.
Or how many of us are driving behind the wheels and can't help to check our phone when that sound comes in, when we get a ping, right? So it's almost like, and then how many of us have been to restaurants, or maybe we're one of those people, where we're sitting there at the dinner table, yet everyone is in their phones rather than engaging and interacting with each other, right? So the addiction to technology and specifically these digital devices is creating a lot of anxiety for a lot of people, because what we're getting is validation. Everyone wants to do a selfie. You know, today is National Selfie Day.
Yeah.
Do you know there's such a thing as National Selfie Day?
I'm refusing to take part.
Right. Well, you know, it's everyone is so focused on themselves now, and it's affecting their sense of self because they're gaining external validation. It's look at me, look at me, look at me, and like me, like me, like me, right?
Yeah.
So their confidence level is coming from external sources rather than internal sources. And that is creating a lot of anxiety and depression for a lot of people.
Yeah, I couldn't agree with you more. I think it's a real issue that we need to kind of confront as a society and find better ways of teaching kids from an early age to respect technology and the dangers of technology, as well as the usefulness of it.
Right.
Yeah, but I guess that's the school system's issue and the parents. And
the parents.
Yeah. So.
But also, it's also social media's responsibility. You know, it's also the responsibility of the creators of these technology. You know, if you think about how social media works, it works to attract you to stay longer.
Yeah.
You know, it doesn't really work for social engagement. No, it's there to see how long, and they track these things. How many minutes are you spending on this page versus that page? And they're using this information to their advantage.
Absolutely.
So it's also the responsibility of the creators of these technology, because what a lot of this is doing, it's causing permanent changes in people's brains. And, you know, we don't know what this will look like in 50 years, in 100 years.
True. Yeah, I absolutely agree. There's a TED Talk, if you haven't seen it, by a guy called Damon Horowitz. He's a philosopher.
Yes.
Yeah, and he talks about that.
Yes, I've actually seen it.
Yeah. So for those listening that haven't seen it, he basically just talks about how, as Jenny was saying, technologists and creators need to think about the morality behind the technology they're creating and how it's going to be used and the potential harms, which is a fascinating talk. How many companies listen to him, I don't know. But so I know we're coming to the end now, so I've got a couple questions. So if you could pick up the phone and call the 20-year-old Jenny, what would you tell that young lady?
I would say, don't be so arrogant that you've defeated OCD for good, because it can always come back.
Yeah. Okay, good message.
And I think that is one of the things that a lot of patients experience. You know, they were at their worst, they get better, and then they feel like, oh, I don't have to ever worry about it again, or I don't have to continue practicing the tools to maintain the gains. And then, as you know, OCD waxes and wanes, and it evolves over time. And if you're not practicing your tools, it will come back. I mean, for me, I practice my tools every time I engage in exposures with my patients, and it still came back. So use that as an example.
Okay. Yeah, good message. And then lastly, you've got a billboard in downtown LA. What do you want written on that billboard for everyone to see? Doesn't have to be OCD related.
Well, one of my biggest passion is to destigmatize mental health, especially OCD. It is so shocking how many people, even in the mental health world, in the medical world, have absolutely no idea what OCD is. And one of the things that really, really upset me as I was doing research on blog forums with mothers, new mothers who were suffering from postpartum OCD, is that there are actually women who have been involuntarily hospitalized by their pediatrician or by their OBGYNs because of their intrusive thoughts postpartum. And, you know, if I had a billboard, it would say something like, OCD is that nightmare that keeps replaying in your head. It is not just that funny guy who walks in and out of his doors all day long.
Yeah.
Maybe that's not a brilliant quote. However, maybe that will set in for some people.
Yeah, really good. I've never heard it described exactly like that. I think that's a brilliant way of maybe waking people up to the realities of it. Yeah. Oh no. Well, I mean, is there anything else that I haven't asked you that you wish you could have shared?
I think we've covered most. We've covered a lot. Thank you for having me. No
worries. It was a pleasure to get you on and obviously talk about all this stuff with you. I mean, I've learned a lot. I've been taking notes as we went, so it's been really interesting.
Well, thank you so much. I appreciate this, and I had a good time explaining what OCD is and isn't.
So thanks for listening, and a quick disclaimer, this podcast is not therapy, it is not a replacement for therapy. Please seek treatment from a trained professional. And until we speak, take care, guys.